Hi everyone. 3 takeaways from this term were some common factors from the therapies we studied. The therapist must not pathologize, but must focus on client strengths. The therapist has a responsibility to build client engagement and motivation. And positive relationships across domains are crucial to client outcomes, but family relationships are the cornerstone of wellness. Also evident in the research is that therapy does not have to be long-lasting to have long-term results. I found it very interesting how much overlap was to be found in the therapies we studied this term. Several were empirically based treatments for delinquent youth grounded in CBT practices such as skills training, in parenting and communication, for example, with a focus on client engagement, pragmatic step-by-step change, a manualized approach requiring a great deal of training and fidelity, and rigorous research regarding effectiveness. From solution-based brief therapy, I learned that one small step can have a snowball effect of change. I was impressed by the questioning techniques from this approach, especially the miracle question and scaling questions, and I will integrate them into my practice. From brief strategic family therapy, I learned that symptoms are metaphoric communication. I will use reframing and restructuring boundaries from this theory. From DBT, I took away the importance with any client of the therapist's unconditional positive regard, but especially for those with more serious mental illness. That we can work with the client to change while showing them they are valued at the same time, just as they are. Functional family therapy includes determining the function of behaviors and replacing maladaptive behaviors with more effective ones, an important part of any practice. MST considers the larger systems and their impact on youth, and the therapist plays an important role as advocate. I believe for social justice that we must be active advocates beyond our offices. MDFT shows that clients must have meaningful and concrete alternatives, real opportunities, to replace the function of problem behavior, which is often adaptive behavior if a client is living in an oppressive system. I will certainly integrate ego mapping into my practice to get the big multidimensional picture of all the protective and risk factors impacting my clients. I continue to be most drawn to narrative therapy from our previous term, as I like its focus on social justice and externalizing the problem. I agree strongly that the problem is the problem. I appreciate that narrative therapy is non-pathologizing, builds on client strengths and previous successes, called sparkling events and unique outcomes, and fosters a true collaborative process with the client. The therapist is not an expert, but a guide. Our society tells stories, constructs, about who we are and who we are supposed to be, and we often internalize this oppression and internalize stories about our problems. However, we can create our own more positive stories, replacing our problem-saturated narratives. We can restore our lives and live these new stories. I appreciate that the narrative therapist works to help the client generalize this new story across settings and maintain it through building a support network and creating letters to the client for their review. Although I want to focus on narrative therapy in my practice, I do see many common factors in all the theories we've studied that are most important to develop. The person, the therapist, the therapeutic alliance, and focusing on developing client motivation and engagement to achieve best outcomes. I think what I've realized as I thought about narrative therapy compared to things that we were studying this term is that as much as I appreciated that there was some focus on collaboration, that I did see many of them as being quite directive. I also kind of worry that so much focus was on the individual's problem behaviors rather than really considering the systems of poverty and racism that are impacting so many youth who turn to drugs as a way to adapt to a very traumatic environment. I hope everyone has a really wonderful break, and I look forward to seeing many of you, I think possibly all of you, at the residency this weekend. Take care.